Okay. So we have started. I hope I'm visible, audible. Yeah, started. Good evening. Good evening to everyone. How are you all? Today is a very eventful day. As you all know, so many news coming. So the biggest news of the day is the NEET PG has been postponed, and it is something which is already in, rumors, etc. It might be, and it actually does occur. Okay. So first is my request would be, please all of you don't take stress. My advice for NEET PG people is, if your preparation are good, focus for INICT May 1 and then give this. Okay. If you are having confidence that my preparation is good, take some test series and you can then do some job. But again, for 5-6 months doing a job will not be sufficient in case it is your main dream to get a PG seat. Okay, those who are weak, I will advise them not to take a job. 5-6 month job, 4-5 lakh rupees is not a good thing compared to your future. So because other people might be studying and you are just doing a job, in job study is not possible. So my request is, don't take a job, rather focus on doing your stuff. Okay, so today we are having this beautiful PDF for us to study and to have, and I hope all of you are going to realize that time is very precious, and I want everyone to give their best and study. Okay, yeah. I already told you. Okay, I already told you. Yeah, key medicine. I will take a special session of hematology, then some GIT, rheumatology, liver, etc. So that will be covered in a special class. Plus, I'll be discussing the important leaked questions from the NB exam. So that's why we are preparing for that session very, very soon. Okay. So let's start PSM today. Already we lost some 5-6 minutes. Okay. So I want you people to do our PSM in a proper detailed manner, and I want everyone to be a part of this. Okay. So should I start? So today, chalo, don't worry, Harsh, you're doing well. Okay, so if you're getting 140s, don't worry, keep revising, it will become 150 plus. Okay, second, I'll be doing basically the basics of PSM, like biostatistics, levels of prevention, screening. Okay, some about the demographics also. Okay, so let's continue. So as you all know, this is the file. I'm just showing you the file. 55 pages are there. This 55 pages cover each and everything: disaster management, biostatistics, how do you calculate standard deviation, what is standard deviation, what are the types of data, what is the, yes, graphs, graphical representation, all is here. Okay, so it'll be done for you. Okay. Okay, Sasika, don't worry about that. I will request you to not give too many tests now. If you're not getting good score, don't give. It will just demotivate you. Rather, just keep revising and solving questions subject wise. That's it. Okay. So that's the case. So biostats, all p-value, all the graph, skew, and then kurtosis, everything we will discuss in my style. Then our demographics. Okay. All this. So we will be discussing everything, and I will be, yes, covering each and everything like growth rate, this, literacy, illiteracy, then very important thing, condoms. Okay, which lots of people are using, some are not using also, that's why population is increasing. So all these things we'll be discussing. Okay, some are factual, some are, again, not very factual. Some we have already covered, like malnutrition we have covered in pediatrics, so don't have to worry much about that. Shaki's tape we have covered already in PSM, pediatrics. So this screening test sensitivity, all would be covered. Half will do today, half or 40%, 60% will do tomorrow. Tomorrow will be the last PSM session. So that's why I'm telling you, please, please, please watch it, learn it, study. It is going to benefit you a great amount. So should I start? Okay, so I'll be basically doing it in my style, and you know my style is very unique style. Basically, I have a summary ready, so I'll be using this summary to do the important topic, and then meanwhile keep on showing the PDF also. So in PSM, first learn the basics. There is three terms that we are very commonly going to use. It is rate, ratio, proportion. Rate, ratio, proportion. Remember, सबसे first rule is rate and ratio are having a relationship between the numerator and denominator. X and Y have a relationship, okay, and proportion are mostly 100. They are percentage. Remember, papa, proportion, proportion, percentage, okay. Whereas rate is again just like a proportion, but we use 1000, or sometimes we can use even 1 lakh also, but it is mostly 1000. So remember, if 100, it is proportion. If it is 1000, it's a rate. And if there is no relationship, it is called as ratio. So it is ratio, no relationship, like sex, X. There's no relation between your X and you now. So sex, X, no relationship. So that's why number one rule to remember is in ratio, there is no relationship. Best example is sex ratio. In sex ratio, it is not total population, then out of that males. It is basically number of females per 1000 male. It is called as your sex ratio. Now, what is the value overall? 943. Now, India was supposed to have a Sensex in 2021, but there was no Sensex. Why? Because of what? Because of a very, very simple reason, COVID. So that is why we are not having the latest data of the India. But the data given as per Mohit sir PSM, he said 929, but net data give in rural the at birth value is 949, and in cases of urban it is 929. Overall 943 is given in most of the textbook. So it is most of the textbook. We'll do everything. We focus on PSM. We will do biochemistry also. Okay, let's do the PSM now. And at adult, the ratio is 102. That is in favor of female. That is, female are more than the male. So interesting development occurring in India, that in India for the first time the females are more than the male. That is why they have passed a women reservation bill in the parliament. That is 33% of parliament seats are going to be occupied by females. Okay, now comes our one more thing, MMR. That is maternal mortality rate. People think MMR is a rate. No, it is ratio. It is maternal mortality ratio. Why? Because the denominator is number of live birth and maternal death, and we use it as 1000. We use it as the 1000. As per India, it is close to 103. Some books say it is now close to 100. So this is your value. It is a sex ratio. Arif, it is sufficient for NEET PG also, because bulk of the question of PSM are conceptual and they are based on this. Okay, so 943 is the sex ratio, sex ratio in India, and it is improving now. It is improving. So waiting for the latest data. Once the data, maybe it will be close to 950 something. Okay, fine. Sex ratio, high sex ratio. India sex ratio is 943. Are you clear? Okay. Then MMR is a ratio, not a rate, and it is basically, yes, maternal death by live birth into 1 lakh. Why we take 1 lakh? In India, it is high value. So if you take 1000, we'll get fraction. So that's why we're taking 1 lakh. So we get a very, very, very good number. Okay. So MMR latest is, yes, 97. So we'll update it. 97. Okay. So in the latest PDF, it is updated. It's 97. And what are the IMR latest? It is now 27. I'll discuss, don't worry. Okay. So let's start. Next is proportion. Proportion is a percentage. Best example is CFR, case fatality rate. It is total number of patient and the number of death caused by the disease into 100. Like example, rabies, it is 100%. Rabies, it is 100%. What about relationship? What is the CFR of relationship? Anyone? What is the CFR, case fatality ratio of relationship? Tell me. I'm using best possible language. Okay. So whenever you are in relationship, how many time you're going to cut? So cutting ratio of relationship, kitna hai? Anyone? Tell me. आजकल क्या चल रहा है market में latest? Tell me the value. Okay, 100%. Okay, as per some people, 100%. So that means it is almost as dangerous as rabies. So please be careful. Relationship fatality, case fatality rate is almost 100%. Okay, fine. Now COVID around 1%. So in COVID 1% people have a chance of dying, okay, and Ebola is 90%, okay, 90%. Now there's a value called as the prevalence. Prevalence is basically the patients who are having the total number of cases. So prevalence is previous and new both. So old plus new is called as prevalence. What is the formula? It is population at risk, or population, it is total population divided by all cases, new plus old, into 100. So first question, prevalence is a proportion because it is in 100. Now incidence is a rate because we take 1000, we take the 1000. And what is the formula? It is new cases divided by population at risk, population at risk, okay, and that is called as incidence. New new is incidence, old and new all together is called as prevalence. It is called as the prevalence. Hello to everyone, okay. Now IMR. What is IMR? IMR is a what? It is a what value? It is a rate or ratio. So IMR is a rate. IMR is a rate because it is 1000. Okay, what is the India latest? So 2023 IMR is 27. Infant, and it is a yes infant death, that is 1 year age, and live birth. So it is infant death by live birth. Into 1000 by live birth. So number of live birth. So live birth by infant death into 1000 will give you the yes IMR. Okay. Next question. What are the levels of prevention? So remember, सबसे पहला there is something called as risk. Risk convert to disease, and disease then cause morbidity, disability, and ultimately death. So remember, risk, disease, disability, death. Risk, disease, disability, death. So remember, whenever disease has started, you cannot have primary. Primary is before the disease. So remember rule, primary is always before the disease. Once the disease started, it is secondary prevention. Now the goal is early diagnosis and treatment. So the goal is early diagnosis and treatment. So all the investigation, screening, diagnosis, X-ray, CT are all in secondary because you are suspecting a disease, and whenever you suspect a disease, it is a secondary prevention. Are you clear? Fine. So it is important to understand, okay. Then what is the outcome of disease? It causes advanced disease and disability. So that's why tertiary is already disease is there. Now you want to decrease the severity of the disease. So disability limitation and rehabilitation. So remember, this is tertiary. Now risk is there, but it is not causing the disease. It is called as primary prevention. Risk is there, disease is not there. Example, a person smoke. Smoking is a risk factor for cancer, but is not yet having the cancer. So stopping the cancer, stopping the smoking will prevent the cancer. It is primary prevention. It is called as a primary prevention. Then mosquito is a risk for, let's say, malaria. Using a mosquito net will not remove the mosquito, but the mosquito is no longer going to bite you, so it prevent the disease. So remember, very simple rule. So follow the rule. The rule say, so if there is a risk and disease, if risk is present, disease not present, what level of prevention is this? It is primary. It is primary. Are you clear? PDF is already in our yes folder. You can click the description. So this is the description. Just click the description, and in the description you will find the PDF. So my request is, please click and you will get the PDF in that. Okay. So let's continue. Then if disease is present, it is secondary. It is secondary. So disease present is always secondary, and if disease is going to cause a disability or death, then we use tertiary. Okay, so disease converting to disability and you are reducing it, limiting it, that is called as tertiary prevention. Now, if you kill the risk itself, it is called as primordial. It is called as primordial. It is called as primordial. Okay, like example, not taking MBBS. Not taking MBBS. So there is no risk of failing the FMG exam. So what is risk? Risk is failure. Risk is failure. So if you don't take MBBS, there is no risk, no NB. So that's why NB cannot do anything. So NB तुम्हारा क्या उखाड़ लेगी अगर आपने क्या किया? If you are doing what? If you are doing yes. Okay. If you are not taking. Clear? Now let's do a very important concept. What are the levels and what are the example? So let's do. Okay, first question is, I'll start from primordial. Not smoking is an example of what? It's an example of what? Primordial. Okay, then primary, you smoke and your papa catches you smoking, and then papa give you cigarette from other end. Now he is making you beat very bad and you stop smoking. That means risk was there, but now the disease is not there. That is primary. Now you are coughing a lot, blood is coming, you go to the hospital, they do sputum examination, they do your what? They do our yes, X-ray, biopsy. This is secondary. Now cancer is there, they remove one lung and you do lung transplant. That is tertiary. Got the idea? So once again, no smoking, primordial. Smoking stop is primary. Then some cough is there, you go for examination, secondary. They give treatment, secondary. And if you have lung transplant, lung is removed, or that is called as tertiary prevention. That is called as tertiary. Okay. Now, first question. What is the primary? Primary is basically specific protection and health promotion. It is health promotion. Whereas health education, traditional living, they all come in primordial. So what is primordial? Primordial is basically healthy living. So primordial is healthy living. So let's start. What is specific protection and health promotion? Okay, vaccine. Vaccine is an example of what? Are you having the COVID? No, you take the vaccine. It is primary prevention. You take vaccine or give vaccine for, let's say, HPV. Are you having HPV? No, but will the vaccine prevent? Yes, it is primary. So vaccines are primary and it is specific protection. Okay, iron folic acid in pregnancy. Again, it is what? It is your primary. But if you're giving to an anemic, it becomes secondary. Why? Because it's using for treatment. So for treatment, it becomes secondary. If before the anemia, like in pregnant, you're giving to prevent the anemia, then it becomes primary. So remember, very good. Then same way, what is the case? Gloves and mask. What is it? It is primary because you are trying to prevent the infection. Now you are having an infection and someone asks you to wear mask so others don't get infection. Then it will become again what? Yes, primary is when you are trying to prevent infection or disease to other people and also yourself. Now comes the question, all the investigation, all the treatment, they come in what? They come in the category of secondary. So screening test, diagnostic test, all come in screening. Okay, tertiary is anything like my glasses. Glasses are what? I am having visual refractive error. Glasses are my treatment, but without glasses I can't see. So that's why I'm disabled without the glasses. So that is why it is my, yes, tertiary prevention. Then wheelchair, artificial limb, physiotherapy, all these are counted in tertiary prevention. It's always tertiary prevention in this case. Okay, fine. Next question. Now OCP, if you give OCP before the pregnancy, it is primary because pregnancy is like a disease, not a disease but still. And if you take OCP in disease, let's say you are giving OCPs for treatment, it becomes secondary. Then one more example is, let's say a person is having antibiotics, prophylactic antibiotics. What will it be counted as? Anyone? Prophylactic antibiotic will be primary, secondary? Primary, secondary? Yes, it is primary. And antibiotic as such is secondary. Got the idea? Antibiotic is secondary. Okay. Now let's take some example. Okay. First there is unsafe sex. Unsafe sex. And you do UPT. What is this UPT is? Unsafe sex, UPT. What is the example of UPT? Primary, secondary? सेकेंडरी है भाई, इन्वेस्टिगेशन है, कांड हो चुका है, नाउ यूर चेकिंग वेदर, सो सेकेंडरी. Clear? Abortion, secondary. Now after abortion there is a uterus infection or hysterectomy is done, so that will be tertiary. Now you have to adopt the baby, that is tertiary. Now condom, what will be condom? Condom, risk is there. Sperm is a very big risk for pregnancy, so condom is primary. And not having sex, no sex, like you people are having before the exam. So no sex is what? No sex, no sex. No sex, primordial. Very good. Clear? Very, very good. Okay. Now, mosquito net. Mosquito is a risk and it is a risk. So risk is present, but net is preventing the malaria. So net stop the malaria. So it will be primary prevention. It will be primary. Okay. Then students can develop back problem or spondylithiasis, and as doctor you prescribe them minus desk in school. Minus desk in school. What is it example of? What is minus desk in school example of? Minus desk. Minus desk. Again primary. Arey yaar. There is no disease. You are preventing the disease. Okay. So that is why minus desk is primary. It is primary. Okay. Now exercise. I'll just make your concept clear. Exercise. Exercise is what? Exercise. Exercise is all three. Is all four. How? If since childhood you do, since early life, this primordial. It is primordial. Okay. Then there is a family history of obesity, or there is a risk of obesity. So there is a risk of diabetes. Parents, then they ask you please do exercise. Then it become primary because the risk is there. You are doing exercise without any risk, that is primordial, but you are doing exercise because there's a risk. So if there's a family history risk, then it become, yes, then it become. Okay. Then if a person is obese and you ask him to start exercising, it is secondary. Why? He is already obese. Exercise is a part of diabetes, so diabetic patient asked to exercise this. And finally, physiotherapy after surgery. So physiotherapy in a patient, or exercise after fracture. So exercise physiotherapy will be tertiary. After fracture will be tertiary. I think the concepts are clear, because my purpose here is not to make you mug up, but to make you understand the concept. So that is why it is tertiary. One more question. Salt. Low salt. What is low salt? Low salt. Low salt. Low salt, salad, good diet, healthy diet. No, it is primordial. Understand? It is primordial. It is primordial. But if risk, example, parents hypertensive, and you ask please don't eat salt, your parents already had. I don't have hypertension, but I am eating, then it is primary. So please remember, they will give a history. Ki parents had a history, or you advise not to eat salt when, so I am 30-year-old and I don't, then it's primary because I am at risk. So 40-year-old asked to take less without hypertension is, but if I am hypertensive and you say low salt, then it is secondary. Then it is secondary. Got the idea? Be smart. Okay. Okay. Then screening driver for color blindness. Train driver for color blindness. It's an example of what? You're screening for color blindness. If it's a screening at the patient level, it is secondary. It is secondary. It is called as secondary. So it is secondary. Okay. Very, very, very good. Chalo. Now let's move on to the next topic, that is the levels of the case. Okay, so I hope one more thing, BCG vaccine is used in treatment of bladder cancer. What it will be if you are using BCG vaccine for treatment of cancer? What is it example of? Tell me. Yeah, if it's for general health of people, let's say you're doing a screening exam of HIV patient for the general, like HIV for prostitute, then it is primary for the general community, secondary for the person. Remember, secondary for the person and for the community in general, it is primary. Very good, very good. Okay. Now, it is secondary. Treatment and investigation. So let's revise. If there is risk and no disease, what is the level of prevention? It is primary. Disease is present. This is secondary. What secondary involve? Test and treatment, early treatment, diagnosis and early treatment, early diagnosis. And what is disability limitation? Disability. This is tertiary. And if risk is gone, this is primary. Okay, like breakup. What is breakup? Breakup is what? Breakup is primary, secondary, tertiary. See, if you are checking the driver for color blindness, this is secondary. If you are testing him for the general public, why? Then it can harm the other people, then it is primary. Remember, if you are doing a test for benefit of general public, it is primary. For that person, it will always be secondary. It will always be secondary. Okay, chalo. So what is breakup? Breakup. Arey bhai, breakup is secondary. We'll take 2 classes. So breakup is secondary. Breakup is secondary. Okay, clear? Then best friend. So your boyfriend, girlfriend has a best friend. What is best friend? Risk. So blocking the best friend from talking is primary prevention. समझ में आ गया? Primary. And no relationship is ना होगा ना कटेगा. So no relationship is your best. So no relationship is best. Okay. Very good. Let's move on. Now we'll see the levels of disability. So mnemonic is basically D A D I D H. D I D H. So D is disease. I is impairment. I is impairment. D is disability. And H is handicap. So who hold the hand? Social. So it's basically social economic. Social economic. So first rule, disease is the pathology. Impairment is loss of anatomy or physio. Loss of anatomy or physiology. That is function. Structure is anatomy. Function is physiology. Disabilities can't perform routine task. Can't perform routine task. So can't perform routine task. Okay. So let's start. Okay. So okay, dance India, dance high. Okay. Yeah. If you're doing screening of immigrant, it is primary. Immigrants is primary because you're doing it for the benefit of your society. So then it will be primary. Okay. Yes, you are right, Medico. It will be primary. Now let's start. So I'll start with a very simple thing. Okay. So there is a, yes, bomb blast. Bomb blast, yeah, war. Soldier. So there is a limb. So amputation of limb. Amputation. This is impairment. So his leg can't walk. So he cannot do the routine, can't walk. That's why loss of job as a driver or as a soldier. So loss of job is handicap. So handicap is loss of job. So loss of job. I will take all, including the remaining medicine. Okay, I'm doing my level best. Please motivate me. Don't say negative thing. Sir, can you take? I am trying my level best. Like you are trying your level best to pass the exam. I am trying my level best. It's an exam for me also. Making slides, preparing the. Do you think it's easy? No, bhai. It is not easy. Making slides, making this, all the content, checking the accuracy. It's very, very tough and tedious work. Okay, fine. Now, a patient developed diabetes. Diabetes. Now, he has impotence. That is no erection. So, no erection. What is the disability? Can't have sex or masturbation. And what is the social? Neighbors. Neighbor, पड़ोसी क्या बोलेगा? अरे शर्मा जी, वर्मा जी, क्या हो गया आपको, है ना? क्या होगा? Yes, it is divorce. So divorce is handicap. Okay. Now he has to use the hand. He cannot use support of other people. So handicap. Okay. Handicap. Easy. Handicap. Or no marriage. Or adultery भी हो सकती है इसके साथ में. Or he might be a victim of adultery. So many bad things can happen. Okay. Easy. Chalo. Let's move on. Okay. So I hope you are enjoying the class. Now remember. Okay. If there's a Bitot spot, that is deficiency, then is secondary, vitamin A. If you're giving to all the children, it's primary. Okay, so we've discussed it already. Okay, now we've done this disease, impairment, disability. So I've discussed it so already. Now come daily. What is daily? It is the years lost to disease. It gives the disease burden in a population. What is the meaning? Disability adjusted life in years. Disability adjusted life in years. It is the years lost due to disease, and it's a negative indicator. That is how many years waste. Like all the my life, I was sick for, let's say, 5 years. So this 5 year is my daily. So 5 year I lost because of my illness, sickness, but I don't lose. I am sick, I then also take the class. I never ever take any holiday, zero holiday. So I have zero daily. Okay, hail is a superior and positive indicator. Why? Because here you don't check. Here you don't check how many years are lost. You check how many years are saved. So it is health adjusted life expectancy. So basically it is how many years of a person in life he was healthy without disease. Like example, let's say life expectancy in India is close to 70. It's actually more for female, 72, less for male. Okay, jaldi mar jata hai male. Okay, now 5 years you lost because of disease. So 65 years of your life you spent without disease. This is hail. So what is hail is? It is basically health indicator. So it's a positive indicator. So what is the, yes, so what is the mnemonic? All hail the Lord. So what is the mnemonic? All hail. So hail matlab healthy. Hail matlab healthy. Okay. Now what is incubation period? Incubation period is the time taken for the entry of the pathogen and the appearance of the sign symptom of the disease. And remember, very simple rule. In general, for most of the viruses, it is 2 weeks. So it is 2 weeks. That is why what is the duration of isolation quarantine in COVID? It is 2 weeks. So 2 weeks. Okay. So that is 2 weeks. Measles 10 day and vaccine is 9 months. Remember 10 and 9. Measles 10-day incubation and 9. And there's a Koplik spot. We'll have this thing in the file. Now next question. What is the difference between quarantine and isolation? Quarantine is contacts. So quarantine is you try to, yes, have the contacts not in contact with other people. That is called as quarantine. And cases, the disease patient are called as isolation. So isolation is for diseases and quarantine is for contact. Then remember, serial interval. What is serial interval? It is from first case to the second case is called as the serial interval. Okay, serial. Then come generation time. What is generation time? It is the peak infectivity. That is, when is the pathogen generating, multiplying maximally? That is generation time. And mostly it is very close to IP. That is, the time person is having sign symptom is the time, like COVID. Any cause, everyone get infected. That's the case. Okay. Now bacteria have very short incubation. Why? Bacteria have faster, process of division, and food poisoning is the shortest, few hours. So remember, few hours because the toxins are preformed, and bacterial are 3-4 day, like pneumonia. Community acquired pneumonia, we have what, 48 to 72 hour window. Like if the infection occur before that, we say it is community acquired. After that, we say hospital acquired, medicine consent. Okay. Next question is, so remember, bacteria is 3-4 day and viruses is 14. Now, what is a primary case? Primary case is the first patient of a particular disease. It is called as a primary. Secondary is basically the one who got the infection from the primary. So that is, if I get a disease and I pass it on to other, he is secondary, I am primary. But index is the D doctor. Index is the one which doctor got first. That is, it was noticed and detected. So remember, the mnemonic primary is first case, but it can be index secondary or other case. So remember, index can be primary but can be non-primary. So can index be primary? Yes. But can it be non-primary? Yes, 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 yes. Blur हो गया? नहीं यार, सही आ रहा है. My end it is coming right. If anyone feel blur, they can inform me. Otherwise, at my end it is coming good. I think yeah, it's coming good. Okay. Thank you very much to everyone for your support. That's why this is my second day of 15-hour session. I started morning 9 o'clock. I went to center. After 7 o'clock, I went to our Calicut center NLC. I took revision there. I took medicine revision there. Then I came to studio. I made a studio here in flat, and I'm taking session from here. And I really say hard work is such a beautiful thing. You might be tired at the end. Your body might be aching. Your back might be gone. And you are so drowsy. But the results are beautiful. Ask a farmer who put all year in that strong sun, rain, cold. And the day he get his crop, that wheat, that rice, whatever pulses coming, that is satisfaction. So that is why work hard now, and the passing certificate, your NEET PG rank will be the outcome. Remember, you will never enjoy if you have not worked hard. Let's say you are born in a very rich family, you get everything, iPhone 15, iPad naya wala, ye do, wo do. You not enjoy. That is why people who have everything easily actually don't enjoy. A farmer, a laborer enjoy a simple bread chapati or boiled rice with so much pleasure. And a rich person, his 5-star food. Why? Hard work. If you're not working hard, your physiological system are not optimized, my dear. You will not enjoy anything. If you want to enjoy, be hungry for the case. Okay? If you're not hungry, eating is useless. Okay? Fine? Yes. So, what is index? Index is the first case that came to the notice detected by the healthcare system. So what is the index? Healthcare system. Healthcare system is the case. Okay. So healthcare system. Now, what is carrier? They don't express sign symptom, but they spread to other. That is, they don't have the problem, but they give to other. Like some of your seniors who already passed, they will say, this year exam will be bad. They themselves have passed, but they keep on passing to others. Negativity. Chronic carrier is more than 6 months. And incubatory is a carrier which spread disease. Even in incubation period is called as incubatory carrier. Now, iceberg. This iceberg was the reason the Titanic sank. Remember Titanic? And yes, they were making painting, having so much fun, and they could not enjoy. Why? Iceberg. So iceberg is basically simply the tip is visible, that is detected cases, but the hidden, latent, subclinical are missed. So that is why we use screening. So what is screening used for? Hidden subclinical cases. And what we will use for this? We'll use the diagnostic method and treatment. So what you'll do in case of the detected cases? So clinically apparent cases, we will give the treatment, and this we will do screening. This for the exam question. Here we will give the treatment. Here we will do the screening, which we'll discuss very soon. So done. So screening is the case. Now, what diseases or what condition don't show carrier? So remember, carrier is not shown if the disease is not having what hidden feature. Like if I have a disease and I have feature, it will not be hidden. Like example, measles, mumps, rubella. Patient will always present with finding, so it cannot have. So no carriers. So no carriers in what case? measles, mumps, rubella. That means they will always have symptoms, signs, etc. Okay. Then rabies, pertussis, tetanus, they are also there. So that is why PTs. Remember DPT. So in DPT, PT, pertussis, tetanus, rabies, measles, mumps, rubella. They are the ones who have vaccine and they are, but no carrier. So what are the no carrier? These are the no carriers. So these are the no carrier ones. Be positive, my dear, and rock. Now comes the question screening. So remember, for this, remember I will make a table and you tell me you got it or not. Okay. So first is, remember what is the concept of the, yes, positive, negative. So first misconception is, what do you mean by positive and negative? First question, positive, negative is test. MCQ. Positive, negative is test. And disease present or absent is our true or false. Like I'll give an example. Let's say a person has the disease and test is positive. Test is positive. That is called as TP. True positive. It is called as a true positive. So it is called as, class is till 11. I'll take till 11, 11, 15. Okay. Tomorrow we'll take very, very long session. Okay. Now, tomorrow will take 3 hours, okay, and we'll finish everything. Today target is this PDF will finish, and the tomorrow we'll do the other PDF remaining topics, okay. So let's start, okay. So first is TP is disease is present, disease is present, and it is test is positive but disease is not. So test is fake test, it is false positive. Example, let's say example is कोई भी एग्जांपल दो. मान लो a TikToker is there, a male TikToker, and his urine pregnancy test is positive. So tell me, is it true positive or false? Male TikToker UPT is positive. It is true positive or false positive? What do you say? Obviously false positive. How can he have pregnancy? So he might act by wearing all the clothes. Clear? So that is why it is false positive. Okay. Now disease is present but test is negative. It is false negative. It is very dangerous. Why? Because disease present but you are saying you don't have the disease, so you'll miss the disease. So you will miss diagnosis. Miss the diagnosis. Very dangerous. And what is this? This is true negative. So remember, the most powerful are TP and TN. TP and TN. TP and TN. Okay. Now comes the question how to remember. I'll make it my way. First is PPV. What is PPV? Positive predictive value. Positive. It tells how much disease a test can truly diagnose. So positive predictive value, the mnemonic is PPP, all positive. So it's PPP. So what is PPP? So write the formula. It is true positive by true positive plus false positive. So all P's. If you take all P's, PPP, itna bhi mat P kar diyo. So PPP is called as positive predictive test. What is it called as? Positive predictive. It tells you the power of the test. That is how many cases it can actually detect. So it will tell you the power of the test. So it give you the power of test. Power of test. Okay. Then come our negative is opposite. Negative predictive value is opposite. Then come sensitivity. Sensitivity. So remember, sensitive लोग को झूठ पसंद नहीं है, तो उसका फॉर्मूला याद कर लो. It is TP by TP plus opposite. Plus opposite. So the formula TP by TP plus opposite. TP by TP plus opposite. TP by TP plus opposite. What is opposite of TP? Can anyone tell me what is the opposite of TP? Anyone? Yes. TP opposite is FN. Easy. So this is the formula for sensitivity. So it is sensitivity. Okay, I'll discuss, don't worry. Okay, all the example. Okay, yeah, maybe he's true positive, we don't know, we have to do examination, maybe per something examination per digital. Okay, then specificity, it is the power of test to remove the yes patient who don't have the disease. That is, it is to confirm, mainly it is reverse, it is true negative by true negative plus opposite. So let's solve the question. What is true negative opposite? Anyone? What is true negative opposite? Anyone? True negative, true negative. Yes, it is false positive. It is false positive. Is it clear now? So that is the formulas you will never ever forget. Clear? So are you clear now? So now let's start. First question. What is false negative means? Anyone? What is false negative means? That disease is there. So this disease, and test positive. Got the idea? So it technically tells you how many disease cases the test is able to predict. That is called as sacha test, true test, sensitivity. So what tells you how many disease patient were actually detected by the sensitivity? That is called as true. So it is test positive by total disease cases. Now you got the idea. Total disease cases. Easy. Total disease cases. Now let's discuss the specificity. It is the reverse. It is not having the disease. And what is total patient who are without the disease? TN is what? No disease. What is FP? False positive. No disease. So it is no disease. Test is negative and no disease. Are you clear? Yes. Now let's come back and do the file. So we have discussed that already. Now remember, first and the foremost thing is, okay, police first find the suspect. He catch or they catch all the culprit. So they will catch all, like entire family they arrest. And then lawyers say, no, it's wrong. This is not. So that is why police can sometimes catch wrong people. That is sensitivity. So sensitivity's test is trying to find as many disease as possible. Now, some of them might not have the disease. So that is why we do confirmation, and that is your, yes, diagnosis. So that's why screening test should have high sensitivity to detect the cases. But to give the treatment and confirm diagnosis, we go for specificity. So that is why we do sensitivity and the specificity both. So for screening, sensitivity should be high. As many cases should be detected out of the total disease patient. For the confirmation and treatment, we go for specificity. क्या था? एक बार check तो कर लो, यही है. So that is your simple concept. Now we'll discuss the demographics. So what is demographic? It is basically crude birth rate. How many birth by mid-year population? Mid-year population is always 1st of July. MCQ. It is 1st of July. So I think I need to revise with you because some of you are still having. So tell me all three formula. What is PPV formula? Answer is all P's. All P's. What is the formula of sensitivity? Senti is TP by TP plus opposite. Remember like this, you'll never make a mistake. Remember like this, you will never make a mistake because most people remember by false positive in the exam. False positive tha, false negative tha, that is the case. So always remember opposite. Never make a mistake. Never make a mistake. So it is opposite. What is opposite is F, false negative, false negative, false negative. And what is specificity? It is TN by TN plus opposite. What is the opposite of TN? FP. Now tell me, is it becoming easy? Is this concept becoming easy? Yes or no? So give me the answer. Easy till now, whatever I have told you, because I am focusing on concept. The facts like point, like this is the ASHA worker, she will be this 10th or 8th educated, she will be, that facts. So facts I will do very rapidly later. Right now I'll focus on the concepts. Okay. Chalo. Now what is CDR? It is crude birth rate and crude death rate. So first question, number of birth by mid-year population into 1000. give you this. India, it is 19.1. That is 1,000 people have how many people born? 19.1 people are born. That is person. Then CDR is crude death rate. Okay, number of death by mid-year population, and India is 6.1. That is out of 1,000 people, 6 people die. And that is why the growth rate is given by CBR minus CDR. So that is approximately 13 or 1.3%. So that means our population increase every year at the rate of 1.3%. So what is our population growth rate? 1. Now remember, if CBR and CDR become equal, then population will not grow. And if CDR become more than CBR, population will decline. So write down CBR equal to CDR. What that mean? No population growth, no growth. And if CDR more than CBR, like in Japan, Russia, that is decline. That is decline. That is decline. Okay. Array, I will discuss Munshi, tension, Nalu, cohort, case control. I will discuss in my style. Now, next question. There are 5 stages of demographic, which is study of population. So let's start. What is that? First is we have the 1. It is called as high. It look like an inverted spoon. Ulta chammach. So it look like an inverted spoon. This is normal spoon. This is inverted spoon. So look like a inverted. So first is high stationary, where lots of babies are born, but also lots of people die. So that is why what is going to happen? That is why what is happening? The population remain very low. That is in early human society. When we used to live in jungle, jingle lala hu, jingle lala hu. So that's when jungle, we had lots of mangal, lots of babies, but they don't survive. So that is why high birth rate, high death rate. Then when we start living in cities and we start to invent vaccine, antibiotic, our death rate start to fall. Birth rate is still high. Abhi bhi dhapadhap lage bachcha banane mein, but people are dying less. So now what happened? The population start to explode. This is called as early expanding phase. Early expanding. Example is Africa, Afghanistan. India was in this stage in 1880s, 1890s. In 1890s, India entered what phase? It entered the late expanding stage 3. What happened here? Here basically what occurs is the birth rate also falls. So what decreases? CBR decrease. And as the CBR decrease, the population stabilizes. The population will stabilize. And if the population stabilize, there is very less growth rate. And now come our low stationary. Both are low. What is that? Both are low. So what is the hallmark? Both low. Birth rate and death rate both are low. What is it called as? It is called as our this. So both low. Example is China, Europe, and India will enter very soon. Which stage? Stage number 4. So India will enter stage number 4. And what is decline? Like in Japan, Russia, population is decreasing. Okay. Now there is something called as TFR. What is TFR? Total fertility. So remember, total fertility rate is basically total number of children born to a female in her entire reproductive life, like 15 to 49. Example 4. So if 4 means a woman on average give rise to 4 baby. Clear? My grandfather, grandmother and other, that time they used to have on average 7-8 kids. Now my time, my parents, they had 3 kids. Okay. And now me 0 kid. What is the meaning of this? If I don't have kid, population is declining. Yes. So that's why Indian population is not increasing, because there are people like me who have almost no kids. But again, I don't mind, because I have Arey chodo USA wala. USA is again growing because of immigration. Okay. So they get lots of Mexican, Indians, so they keep. Okay. So that's why not sad life. Okay. Okay. Dr. Subhashri Jana is not a sad life. Okay. I am busy life. Okay. When you're busy, you don't realize you have a problem. Okay. So that's why I am happy, because I don't have any liability. I don't have to worry about, which side of bed to get down from. Wait for toilet, when the toilet will be empty. Okay, I don't have to drop kids to the school bus. Okay, I don't have to, yes, go to school PTA and then talk to other children. Their Sharma ji ka ladka rank first aa gaya, mera nahi. So I am relieved. I don't have this all, yes, findings. Okay, so that's why I don't have to worry about all these problems. Okay, yeah, clear? Yes, and yes, you can do anything. Okay, you can leave your towel on the bed. No one will mind. Your socks are anywhere, no one will mind. Okay, you can sleep in any position, any condition, no problem. Clear? So you don't have to, yes. So that is why, yes. So you are my children, adult children. I'm very happy. Okay, now what is the GRR? GRR is gross. You can remember it like girls. So it is the girl child born to a female. It's a roughly half of TFR. So if 4 were the total child, 2 will be girls. So that's why it is GRR. Now remember, if you subtract the mortality from that, that is before a girl child can become adult enough to give birth, that if you subtract, that is called as your NRR, net reproductive rate. What the definition? It is total number of girl children born to earth. This is actually net reproductive R, NRR, including, yeah, excluding. It is basically, we are not going to include the mortality, so we have to exclude the mortality. Like example, if it was 2, it will be slightly less. Let's say we remove 0.1, for mortality it become 1.9, so it become 1.9, so it become 1.9. Okay, so are you clear? So that is the simple concept. Okay, so GRR and RR, GRR and NR. Okay, now first question is, replacement level is achieved when the population is having a TFR of 2:1. So if it is 2:1, that is hum do hamare do, 2 people, that is couple, give birth to 2 people, that is around 2.1. That means the population is stabilized. So that is called as your what? Replacement level. And what is that convert to? GRR of around 1.05 and NRR of 1. So that is why they ask in the exam, what is the target level? So what is the target level? Target level for replacement? Tell me, what is TFR, total fertility, and NRR? Anyone? What is the replacement level? What is the replacement level? Yeah, India already has reached TFR of 2.1. India achieved it in 2000, I think 21 or 22. India already is reaching TFR, and NNR should be 1. NRR should be 1. NRR should be 1. Okay. So NRR should be 1. TFR is 2.1. Okay, Dr. AM, not 2.2, it's 2.1. Okay, fine. And for that, we need to have a CPR, couple protection rate, of 60%. That is 60% of eligible couple are using family planning method. Is called as the which condition? It is called as CPR, couple protection rate. Let's see that. So what is couple protection rate? It is, yes, 60% or above use family planning. Then the, yes, the TFR will be around 2.1. Okay, 2.1. Now we're discussing the indicator of our, yes, development of a country. To hi-fi country use what? HDI, Human Development Index. It is hi-fi. So क्या होता है? 0 or 1. Either you are first class or 0 class. So it is 0 to 1. Whereas India, poor country, use PQLI. That is, yes, physical quality of life. That is mainly poor country. Now remember, formula is same. Ille, ille. So I make a mnemonic. Ille, ille. इल है वैसे, पर मैंने इल्ले इल्ले बना लिया. So the mnemonic इल्ले 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 इल्ले. What is the इल्ले इल्ले? Income. So rich country always think about income. So income. Okay. See, TFR is basically total children born. Half of that are girls. That is called as our what? That is called as our GRR. G for girls, gross. And what is the mortality if you rule out? Then it become NRR, net reproductive age. Just remove the 5-10%, that become NRR. Okay, ISM Bishkek, done. Okay, now remember, what is ille ille? Income, literacy, life expectancy. Now remember, they check life expectancy at birth. Indians, nalle log, they take life expectancy at 1 year. So that's the main difference. If they are asking what is the case, that is life expectancy, that is why we compensate by adding IMR. What do you add? IMR. Okay, fine. So India actually has fallen. It was 6.5. Now currently it is around 6.43. So latest data says 6.43 is India value in this case. So 6.4. No, it's, I think I mistake. It is 64. It's around 64. Okay, 64. Okay, it's not 0.5. That's something else by mistake he wrote 6.5. Don't get confused. Okay. Now India, it's 6.47. It has fallen to actually 6.42 something. Okay. So let's see. Let's revise it with me. So can you people tell me, what is the HDI 0 to 1? And it was invented by a, yes, Pakistani economist. Okay. I don't know, remember the exact name. I think Shaukat Tahir something. So it is 0 to 1 and it has ille and PQLI also ille. Both are ille. I for income. I for income. L for life expectancy at birth and L for literacy. Literacy in terms of school years. Literacy means how many years the person spent in school. That is called as literacy. That is called as a literacy. Okay. Shiv, I'll discuss that later because even I have to look at the data. Okay. Why is my camera frozen? 1 second. Okay. Aja bhai. I think my camera has become disabled. Okay. Now it's back. So disability ho gayi camera. Okay. Chalo. And what is the third? It is literacy. And what is the poor country? India is 6.47, but now it is fallen down. It's around 6.4 something. I'll just show you. I don't lie. I have full knowledge. So, right? India HDI 2023. See, so India is fallen 6.33. India has fallen 6.33. I don't lie. I check it 6.33. So it was 6.5. Now India has fallen. So the latest value 6.33. Jhand hai jindagi. So India has fallen 6.33. I don't know why the lag is there. Let me check. Camera has the lag. कैमरे को कुछ दिक्कत आ रही है ओ भाई साहब Array, again, if I give you explanation, it's not India which is falling behind. It's other countries which are running ahead. Okay, India is not falling behind others. वो बाकी लोग आगे चले समझ में आ गया. So that's why don't feel bad कि अपना कम कैसे हो गया. कुछ नहीं हुआ. Other countries are. अबे आजा भाई कैमरे. पूरी फीलिंग खराब करता है कैमरा. बिना देखे मजा नहीं आता ना. Like we are doing a video chat and video नहीं आ रहा. क्या करोगे बताओ है ना. आजा भाई साहब. Okay, remember, yes, when new mobile phone came, Nokia, they didn't had what, they didn't had cameras, only calling was available. Okay, and then cameras came but they are not having video call, and then video call came, it was very poor quality. Then now HD quality. Okay, and there was a time people used to write letters. So that's why everything is having good or bad side. अबे भाई काहे तंग कर रहे हो. आजा मेरे भाई. India is in, yes, stage 3. late expanding. I don't know what is the problem here. We were enjoying the class, giving so much informative things. Suddenly, this damn बिना कैमरे पढ़ने में मजा नहीं आएगा ना. Like COVID time, ठीक है, you are talking to your friends, maybe your XYZ friends, and camera is not working. Will you enjoy? Nah, never. So that is why camera is a must. Just give me 1 minute. I will add new camera. आ गया, आ गया. ठीक है, wait, I will make it better. Don't worry, okay? It will take some time. It's not an easy job taking classes without a proper studio, but I am always dedicated and I am always going to work hard. Now it's okay. See how much effort it takes to bring things back to the normal. I hope it's clear now. Now it's okay. Chalo. Yeah. I want nothing from you people. Just study, just pass. That is the biggest gift I can give. So just want all of you to study and pass. Nothing else we require from you. Okay, pass and just say a single word of thanks. That is more than sufficient. Clear? Because as teacher, what else a teacher want? Student passing is the main thing. Okay, so let's continue because I will not be putting more time correcting the datas. Then BPL is what? Below poverty line. Okay, what are the criteria? It is calorie intake. Okay, urban it is less than 21,000. Rural people need more energy because they're working day and night. So in the rural population, the criteria is slightly different. So in the rural population, the criteria is yes, 2400 calorie. Okay, income you can skip, is not this. Now, socio-economical classification is given by Kuppu-Swamy scale. So Kuppu-Swamy scale is basically for what? It is basically for the socio-economical classification. Symbol में तुम्हारी औकात क्या है? What is your level? Okay, India people give respect to other based on the language, based on their dress, etc. So ये सब बहुत important है इंडिया में. इंडिया में people don't respect anything except how good you look, how are your features, etc. So Indian people are one of the very racist people, very racist. चलो next, biostats. Biostats. So first, what is biostats? Basically, it is analysis of data by applying statistical tool. How do you get the data? We get from studies like experimental study or analytical. So what are the studies we have? So studies like analytical or experimental. Experimental example, RCT, analytical cohort, or CC, case control. So we'll discuss them later. Survey, we can do the surveys for getting the value. So we can use the surveys. So what we can use? We can use survey as well. Okay. Done. So survey can also be used in this case. Right. Now the data that we obtain, data or data or data. So data is of two types, qualitative and quantitative. So now remember, qualitative is discrete. It is discrete. What does discrete means? Spelling is discrete, means it is either yes or no. It is yes or no. Whereas quantitative is measurable. It is continuous data. It is easy to measure and it can be measured in kilogram, gram, meter, second, all. Okay. Whereas quality you cannot measure. Like example, someone asks you, what is the quality of your life? So what do you say? 2.6, 4.6? No, what do you say? Good, bad, okay, okay, average. Or someone asks you, how is your experience with your ex? So what do you say? 10 number, 5, what do you say? Good, bad. So that is why you cannot measure it by the number. Yes, surgery will also do. So we cannot give it by the number. So that is the problem. We cannot give it in the numbers. So that is the whole soul story. So if it is not given by number, it is called as what? It is called as our which phenomena? Yes, it is called as our, yes, qualitative. Second, it is difficult to measure. That's why we express it either in percentage of frequency. What does frequency means? Number of time a particular value repeat, like number of people who are having jaundice, people having COVID. So that is called as frequency, and we can measure the percentage also. Okay. Now, biggest misconception people have is they think that a particular thing is quality. Now remember, quality, quantity can be converted to quality, but quality cannot be converted easily to this. Let me teach you how. Understand? See, age. Can anyone tell me age is quality or quantity? Tell me. Age is quality or quantity? Tell me. Age. Tell me. Now remember, if you measure age in years, it could be 1, 2, 3, 80, 90. So it is your quantitative, quant. But if you measure it as young, old, then it becomes quality. Got the idea now? So it is quality. So that means you can convert a quantity into quality by making category. How? By categories. Got the idea? Okay. Then can anyone tell me weight? Weight is quality or quantity? Anyone? Weight. Weight is quality or quantity? Weight. So tell me weight. Weight is quality or quantity? Weight. Tell me weight. So again, weight is if in kilogram. If it is in kilogram, then it is going to be what? If kilogram, it is going to be what? Kilogram. If kilogram. If kilogram, it is going to be surely quantity. So आगे से I'll just say the word kT, Q. And if you measure it in light, heavy, obese, then it become quality. Okay, very good. Now you got the concept. Now you got the concept. Actually, I'm a trained biostatistician. I did a 6-month course from UCMS, that is Guru Tegh Bahadur Hospital. Now, next question. Religion. Religion is quality, quantity. Religion. Yes, quality. Because Hindu, Muslim, Sikh, they are not superior, their numbers are different. Like example, Hindu, let's say 80%, Muslim, let's say 15%, then Christians, let's say 3%, Sikhs, let's say 1%, something like that. Okay, Jains, other. So that is percentage. So you are showing it in percentage. This is quality. This is called as the quality. I think now you got the concept clear. So this is our quality which we are seeing. Okay. One more thing, gender. Gender is what? Gender. Not saying Tinder. Gender. Quality, quantity. Gender. Quality. So gender is quality. So gender is our quality. Okay, very good. Why? It is male, female, or the third gender. T is third gender. Chalo. Now let's continue. Next is right now. How do you express the quantity always as average or mean? Average or mean. Now, what is FMG exam pass fail a example of? It is either pass or fail, so it is a quality. But how many number of pass or your score? Marks is quantity, but pass fail is quality. Now, types of data. Qualitative is two types, not category, but jo bhi. One is nominal and other is ordinal. In nominal, there is no gradient. So it is no gradient here, arrange in order. So there is a low to high. So if there is a low to high, like example, T and M, tumor staging, like that tumor, then lymph node and metastasis, or the severity index, it's severity. So what is severity? Mild, moderate, severe. It is our ordinal data. So it is what are our ordinal data. Whereas religion are all equal. So that's why you cannot have any kind of order. So if there is no order, it is called as nominal. Only name is there. Different names, different name. If there is an order can be arranged, it is called as ordinal data. Ordinal data. Okay. If only two values are possible, like pass fail, male female, yes or no, it is called as dichomatous pass fail. If there are more than two, like religion, ABO, TNM, it is called as polycomatous. Okay, so that is the case. Now let me ask you questions. So question for you people is as follow. So what is the question for you people? Let's discuss that. Okay, so question for you people is as follows. Let's discuss. So right, question. So what is the question? Okay. If I ask you what is the case, option there are nominal, ordinal, that is categorical. They are categorical. Okay. Example and dichomatous, polychomatous. Okay. So first question. If I ask you, let's say severity of anemia, it will be what? Nominal or it will be ordinal? Nominal or ordinal? Okay, it is ordinal. Very good. Mild, moderate, severe. Very good. If you are doing, let's say you are doing, what is the, yes, preference? People love morning breakfast, what they take, tea or coffee. So tea or coffee, that is selection of beverage. What is the example of? Tea, coffee, or something else also? It's an example of what? Tea, coffee. Ordinal or nominal? Ordinal or nominal? So what is the value? It is tea coffee. If tea coffee, it is our nominal. It is our nominal. Very, very good. Now let's continue. Now there is something called as the measurement of central tendency or central theorem. That is, we are trying to find the middle point of the group or the data set. for comparison, because you cannot compare the richest person in India with the poorest person in America. Or let's say you are comparing a African country which is very poor, and you take the richest person of that country with a poor person of America. Say, hey, Americans are poor. Like Ambani is in top 10, but that doesn't mean India is a top 10 richest country. India is in 130 place in terms of per capita income. So that is why it is the case. Now remember, there are three: mean, median, mode. So what are the three? Mean, median, and mode. So mean, median, and mode. So these are the three: mean, median, and mode. Now remember, mean is the average value. Mean is the average value, and it is always for quantitative. So quantity, remember, quantity is mean. Quantity is mean. And it is affected by outliers. What is outlier? Extreme values. Extreme values. Okay. Then mode. Mode, remember, Modi ji. Modi ji. Modi ji is the name you hear everywhere. Modi ji, Modi ji. Like Maldives saying Modi ji, fakir person, this. But, and our people, Modi ji, we love you. So Modi ji and Italian Prime Minister, okay, Meloni, she love Modi ji, Melody. So that's why people love Modi ji. Some might hate Modi ji, but Modi ji is the most popular name. So that's why what is the most common name called as? It is mode. So it is the most common. So MC is mode. MC is mode. And it is the most common value. Like example, you're making a group and you're checking how many people drink tea and how many coffee. So we'll take a frequency and we see the people, let's say people who are drinking coffee more. So that's why the mode is coffee drinker. So that is called as mode. And it is mainly used for nominal data. Why? Modi ji naam hi kafi hai, name. So nominal is name. Nominal is name. Okay. Yeah, it's an important topic. 100% exam question. Okay. Then finally come the median. Median is the middle value, like my hand. In my hand, how many fingers are there? 5 fingers. If I take 2 fingers here and 2 fingers here, this is the 1 finger. This is median. I'm not showing you finger. I'm just telling you. This is median. So median is middle value. Okay. Like your 2 legs. 1 leg here, other leg here. Then if you have another leg, it will be your median leg. Okay. Clear? So that is middle value. Okay. Now, first is we arrange it in an order and then we will check. Remember mnemonic Om. So remember, median is cutting the ordinal and outlier. So remember, for ordinal data, we always use the median. I'll repeat, don't worry, patience rakho, aega. So we will use the median. We will use the median. समझा रहा हूँ, सबर रखो, patience. Okay. So first is I will explain what is the mean. Mean is basically sum of all the values divided by number of sample. Okay, that is called as the mean. Okay, then median is we arrange it in a order and take the middle value. Take the middle value. Now, if n is odd, like example, if there are 9 values, we take 4 value here, 4, fifth value is the median. But if it is what? Odd, we take n plus 1 by 2 as the value. N plus 1 by 2. Thank you, Dr. Shankar, is 2. So let me explain. And if n is even, then we take the average of two middle number, like example 5th and 6th. I'll take example, it'll make you easy. Okay, let's say we have data 1 rupee, 2 rupee, 3, 4, 6. Let's do it. First, how many samples are there? 9 samples. So what is the n? N is 9. So n is 9. There's no lag, Sam, from my end. Please check your end. So it is going to be what? It is going to be, yes, n is equal to 9. Sum, when you add them, 4, 8, 8 or 4, yes, 14, then 9, so it is 27. Sum is 27, so mean will be 27 by 9, 3. So 3 is the mean. All understood? So what is the average value? 3 is the average. Now median. Median will be n plus 1 by 2. So fifth value. So fifth value is our this. So what is the fifth value? 1, 2, 3, 4, 5. So this is our fifth value. So this is the fifth value, this is median. This is median. This is the median. Have you understood this? So four values are this side, four are this side. It is the middle value. Okay, like my finger. Two here, middle value. Now, what is the mode? Mode is most common. Let's say how many time one come? One time. Two come? Two time. Three come? Four time. Four come? One time. Six come? One time. So what is the most common value? 3. So 3 is the mode. So what is the story? Mean, median, mode. All are equal to 3. This is called as normal distribution. This is called as normal distribution. So what is normal distribution? Mean, median, mode are equal. Let me do it in my style. So now first tell me, okay, what is average value called as? Average, mean. Average is mean. So average is the mean. Now are you clear? And it is done for quantitative data. Then what is the middle value? What is the middle value called as? Median. And what is the most common? It is mode. And it is used for which data? So it is used for quantitative, it is used for nominal data. Nominal. So मोदी जी, नरेंद्र मोदी, मित्रों नरेंद्र मोदी मेरा नाम है, तो याद करो नॉमिनल मोदी जी, नरेंद्र मोदी, नमो नमो, नमो 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 मोदी जी, नाम जपो, मोद, easy. So it is mod, it is mod, it is mod, it is mod. Okay. Are Baba, nominal just means name. We are counting how many time a particular name come, like one number, two number, three number, or 5 kg, 10 kg, or you are measuring Hindu Muslim. So how many time the Hindu name come? So that is called as nominal. Nominal just means name. So nominal means name. Nominal means the name. Okay. So clear? So are you clear? So let's go back. Now question is, if you add another value, if you add another value which is very big, it is called as an outlier. What the outlier is? It's an extreme big value. What the outlier is? It is outside. Like example, in a poor person village, a rich person start to live. So what will happen is their income will change. No, it will remain the same, but their average will change. So let's solve it now. So now the range is 1 to 33. Earlier it was 1 to 6. Now the range is 1 to 33. What is the sum? Sum is 60. Sum is 60. And n become 10. N become 10. Let's calculate the mean. So mean is 6. Same or increase? So mean increased. Mean has increased. Have you understood? Mean has increased. Mean has increased. Okay. Then comes the question about the median. So what is the question we will discuss or see about our median? So what is the question related to our median? It is fifth and sixth value. Both are 3, 3. So it will remain 3. So it will remain 3. Are you clear? So it will still remain 3 because you take the middle two values. So this is median, still 3. So median is still 3. Are you clear? So median is changing, not changing. It is not going to change. So median is not going to change. Are you clear? And what about the mode? Mode will also remain 3. Why? Because it's just extra one value 33. So that is the case. So first question is, in case of outlier, what is affected? MCQ. So what is outliers affect? Outlier change what? Tell me. Outlier change what? Mean, median, mode. Outlier. Outlier. Yes. outlier is going to change without any doubt our which value? It will change mean. But what is same? But median remains same. So median doesn't, yes. Harsh, just attend, listen, don't try to think. Just listen what is being said. You will be able to study, okay? So that is the case. So that is why for outliers, what is used? So for outliers and ordinal data, we will use our median. So what do we use? We use our median in this case. What do we use? Median is used. So median is used. Have you all understood? Now let's come back. First is normal distribution is also called as Gaussian distribution, and its mean median mode should be equal, and it should be bell shaped curve. What is the shape is? Bell shaped curve with 50% population in this half and 50% this half, and this should be your mean median mode. So half are above the mean, half are below. Let's say Indian per capita income is, let's say, $2,000. So that means half the Indians earn more than 2,000, half earn less than 2,000. So what divide the population into a perfect two half? That is your mean value. That is your mean value. Okay. Next question. So what is something called as standard deviation? Standard deviation is basically also denoted by sigma. It is basically showing the square root of variation of each value from the mean. Okay, so it is how much is the variation of each value. Example, a value of mean is 3. Like example, here the mean is 3. So here there is no difference, but here the difference is 1, here the difference is 2, here difference is 1, here difference is 2. So this difference when you add and square, that is called as SD. What is SD? You can take an average distance from the mean. So that is called as standard deviation. So what is standard deviation? Average distance. Let me give an example. Okay, let's say FMG exam results we are discussing. How many students give the exam? So 10,000 students gave the exam. So 10,000 students gave the exam. What is the range of marks? Minimum score was 0 and highest was 246. So this is the range. So what is the range is? It is 0 to 246. Now what was the mean value? 135. That means half the students got above 135, half got below 135. So how many people got above 135? 50%. That is, so what is more than 135? 50% population. How many students? That is 5,000. And how many are below 135? That is again 50%. Now you got the idea. So that is your simple yes concept. Okay. Now let's continue. So this is the yes curve. Now I have a question. If I add standard deviation, the range will become bigger. So it will increase the range. Let's say example, standard deviation is around 10. So 10 is the average deviation of marks from the mean. So what is mean plus minus 1 standard deviation become? It is now 125 to 145. So do you think it will contain less or more population? More population. Around 68.2% population will lie in what? It will lie in our mean plus minus 2 standard deviation. So that is 680 students out of 10,000 have which marks? They have marks in what range? In the range of 125 to 145. Are you getting the concept? So that is the case. Now if you increase the range further, even more population will come. Example, now we say mean plus minus 2 standard deviation. So that is now 155 to 115 to 155. Now it include 95%. Actually it's 95 something. So 95% population. And if you take 3SD, 99% population will come. So let's revise. So how much population come in 1 SD? 1 SD, 1 SD, 68. How much come in 2 SD? It is 2 SD. It is our, yes, 95. And how much come in 3 SD? It will be 99%. Are you clear? Now, on average, anything which is present in 95% population, let's say blood pressure. If blood pressure of 95% population is below 140, it is normal. If the hemoglobin of 95% population is below above 12, that is normal. So that is why values which are outside the 2SD are present in only 5% population. That's why they are abnormal. So that is why, what is the clinical criteria? We doctors know. How do we say he's hypertensive, hypotensive? The answer is, again, biostatistics. Any value which is outside the 2SD range, it is not normal. It is occurring in very few population. So it's very high or very low. That means it is abnormal. Let me give an example. Okay, wasting. How do you say this baby is wasted? My weight is low. My height is low. Am I wasted? No. 2 standard deviation. If I lie in 2 standard deviation, I am normal. If I'm outside the 2SD, that means my height is less than normal. I am stunted, or if my weight is low, wasting. So the criteria for our abnormality, 5%. So that means also called as confidence value. So 95% is the confidence value. So all the rule of biostatistics is 2 standard deviation के अंदर value is normal, and if it's outside that, it is abnormal. That is 5%. So that is why it is called as the confidence value. So what is 95% called as? It is called as the confidence value. And if something is 3 SD, it is severe, because now it is only 1% population. That means what? 1% population. So all population have only 1%. So it's an abnormal condition. That is, your weight is 1% of the normal population. That means you are a very rare weight. You are a abnormal weight. Okay. You can be underweight. You can be overweight. So that is why severity is 3 SD. Let me revise. What is clinical criteria? Can anyone tell me what is the, thank you Shafiq, okay, thank you, Kushal Sahil. So what is the clinical criteria for normal? What is normal? Normal is if you are within 2 standard deviation, 95% population, you are normal. अब समझ में आ गया? You are in majority. आपकी डेमोक्रेसी है, आपकी सरकार चलेगी. But when do you say it is disease or abnormal, like anemia, obesity, whatever? Answer is if it is outside 2 SD. So that is, now you are in not 95% of population, you are in 5% population. That means you have disease. Okay. And what is severity? What is severity? Severity. Severe. See, if you take blood pressure, I'll tell you this is less than 140/90. So they are not hypertensive. These people have more than 140/90. This is biostats. So how many population will have BP more than 140/90? 2 standard deviation. 2 standard deviation. Okay. And for severity, 3 standard deviation. So 3 SD is severe. 3 SD is severe. Now you understood? Okay. Medico, just watch the lecture once again. You will get the concept clear. Okay. Fine. So how much value is seen in normal population? 95% is mean plus minus standard deviation. अब बताओ, your weight, is it normal, abnormal? Normal. How do you know? 95% of Indians have weight just like you. That's why it's normal. But if your weight is 200 kg, is it normal? No, it is abnormal. You are in that 5%. If your weight is 15 kg, again it's abnormal. So that's why, how do we doctors know something is normal, abnormal? So this is 95%. 2 standard deviation. This is normal. This is green zone. This 5%, is the abnormal. Abnormal. Now tell me, is it clear? Yeah, sure, sure, sure. We'll take. So now you understood? Have you all understood why we take 2 standard deviation? Because 95% population come in the 2 standard deviation rule. So what deviation? 2 standard deviation rule. Okay. Chalo. Now let's come back. Now outliers. If you add outliers, the graph will shift. Like example, average score is 135. If you add NLC students score, they score 200. So the graph will shift to the right side or the left side. This is called as skewness, which I'll discuss soon. So there could be either positive skew or there could be a negative skew. Okay. Positive skew means the mean median mode. What is happening? The mean is more than median is more than the mode. So that is called as a positive skew or a negative skew. This I'll discuss later. Let's come to the next topic. That is our null hypothesis. Yeah. See, right shift, left shift, positive skew, negative. It's slightly reverse. Negative is for right, positive is for left. I'll discuss it later. Okay. Skip it now. Okay. Next question is null hypothesis. Null hypothesis. It say two groups are same. Like example, I say FMG and IMG doctors have same hardworking ability. So this is my null hypothesis. So there are two kind of error. Alpha error. Alpha error say null hypothesis is true. That is FMG and IMG are very hardworking doctors. But it is rejected. That is the government doesn't accept and they put a FMG screening test for you. That is called as alpha error. In Hindi, if I say sachi baat ko na manna, that is you are telling the truth, but people don't believe you. It is called as the alpha error. Like example, your girlfriend, boyfriend ask you, where were you in the night? And you say, I was sleeping. Yeah, I was studying. And she doesn't believe you. That is called as alpha error. Alpha is don't accept the truth. So remember, don't accept the truth is alpha error. It is called as the alpha error. Okay. Yes, you are right. Next question. What is beta error? Beta is reverse. The null hypothesis is false, but still you accept it. Still you will accept. This is called as your beta. So something is false, but you accept. Clear? Like someone tell you that you are, not good doctors. You are bad doctor, and you accept. Yeah, we are bad doctor. So that is a beta error. So beta people are accepting even the false things. Okay. Alpha are not accepted despite being right. So are you clear now? Chalo. Now, how do you compare the group? Basically, we take a probability value of p-value. Again, we take 5%. What is the value? 5%. What is 5%? Also written as 0.05. 0.05. Now, remember the rule. If the p-value is above 0.05, that is our standard deviation is within 2SD. That means there is no difference. You are a healthy person, you are normal. So the groups are same. The groups are same. There is no difference. The null hypothesis is true. But if the p-value is less than 0.5, then the two groups are not same. One is different from the other. So how do we doctors know two drugs, two treatment, two surgery are same result or not same result? We check the p-value. If p-value is more than 0.05, it is not different. They are same. If less than p-value is 0.05, that means the groups are different. The drug is more effective. So let's see. If two drugs are compared and we check the p-value, what do you check? We check the p-value. If the p-value is more than 0.05, they are same in their efficacy potency. If it is less than 0.05, then they are different. So let me now give you a very final summary. Two groups are compared. Compare two groups. How? By p-value. By p-value. By p-value. So how do you compare two groups? The answer is we check our p-value. So what do we check? We check our p-value. MCQ. So what are we checking? P value is to be checked. Now, can you people tell me what is the story about the P value is? Can you tell me? Yes, the P value is if it is 0.05 or less. What are the meaning? Groups different. And if it is more than 0.05, then same groups. No difference. Okay. So I'll give an example. Let's say if you can solve or not solve. Should I give an example? Are you ready for example? Okay. Now understand. Okay. Understand. So for the example I am taking, what is the example? Please understand. Let's say I say drug A is better than B, or your current is better than X. Than X. So I give you P value. P is 0.02. What do you say? What do you say? Is current better than the X or they are same? What do you say? Understand. No one will make you understand. Any teacher can come. If your concept is not clear, you will all life be confused. Yes, it is less than 0.05. That means they are different. Different means one is better. So it is true. It is true. One is better. Current is better. Abhay, true है भाई, true. The groups are different. The groups are different. Current is better than the X. Now, if P value come 0.7, 0.7. Now tell me, are they different or ये वाला भी वैसा ही है? मतलब this one is the same as the old one. फिर से आपके साथ धोखा हो गया. फिर से आपको सेम माल चिपका दिया गया. So tell me, that means it is more than 0.05. That means they are not different. That means they are almost same. Okay, so easy. So now tell me, is biostatistics looking difficult or you are having a good command over this? So are you now finally having a good command over the biostatistics? What do you say? Good command. Because I am someone who is a proper teacher. I am not here to just, do formality. I am someone who go till the very end. So I will go till the very end to make you understand. Fine? अरे जो बता रहा हूं वही संभाल लो, जो गुस्सा है उसको याद कर लो, ठीक है? So first is take two groups, drugs or vaccine, then get P value by test of significance. So test of significance. So get the test of significance. If P less than 0.05, if P more than 0.05. What is the meaning? If less than 0.05, are the groups same or they are not same? What do you say? Are the groups same or not same? Group. Thank you, Ace Ventura. Very good movie. Jim Carrey. Okay, so it is different. मेरी वाली अलग है या मेरा वाला अलग है. Remember, it's a very common dialogue. This one or this time is going to be different. Every time you are touching fire and you say it will not be hot, are you mad? Fire is always hot. A knife is always sharp. It will always cut you. So different कुछ नहीं होता. Same. तो अपना P value तो बिल्कुल 1 है. So हमारा P value तो 1 है. For me, P value is always 1. Okay, always 1. Now, what are the last topic? Then I'll finish the class in 2 minutes. What are the biostats is almost over. Graph is left, which I'll do tomorrow along with epidemiology and health program, and we are done. So, test of significance. So remember, there are two types. If it is qualitative data, that is yes, no, pass, fail. Okay, remember, then we have to apply chi-square test. What test? Chi-square test. Which test? Chi-square test. Okay, chi-square. Now it's not chi-square, it's chi-square. So how to remember? And it is 2 by 2 table, like this, like this. Okay, so smoke, no smoke. Cancer, no cancer. A, B, C. This is called as your what table? 2 by 2 chi-square table. 2 by 2 chi-square table. I will do surgery by attend the session. You will get it. So it is 2 by 2. Okay. Now remember a very simple rule. Which country quality of product is not sure? China. चाइना का माल चले तो चांद तक वरना रात तक. So quality is always doubtful. China make world class product also, they make chalu products also. So Chinese quality is always in doubt. I'll give example of Chinese quality. China is the country which make original Puma, original, but also make Pumu, Pamu, Pupu, yeah, Pumu. So it is the country which make all the yes products. Okay, clear? Media, it's soon by Sahil, please wait, we'll post. We are dead busy. I am working 15-16 hours. Our team is dead busy in making grand test race. Like we people are completely, dead. Then it make Adidas and Adibas. So it is the country which make all type of products. Remember, quality is China. So quality is China chi-square. So quality is China chi-square. Will you remember this? So quality is Chinese mal, chi-square test. Chi-square test. And all other tests are mostly quantitative. So now remember, quantitative. So for quantitative analysis, so test for quantitative parameters. So quantitative, now remember, example is marks. So who's always fighting for marks? Student. Example marks. So student t-test. Student t-test. So what test we apply? Answer is we will apply, yes. Okay. Yeah, tomorrow mock test is there. Please give it. We'll start in the morning. So let's. So it is our student t-test. Student t-test. Okay. So now student t-test. Okay. It is two type: paired and unpaired. Paired and unpaired. Now remember, unpaired is between two different groups. So when you apply between two different groups, example, you compare the mean marks of Delhi versus, let's say, Mumbai students. It is called as unpaired test. What is unpaired is? Unpaired is two different group of students or subjects or whatever. Okay. Paired is same group. Same group. Group is same, but different time, different drug, but different time और ड्रग और इंटरवेंशन. जैसे क्या रहा, पाकिस्तान की टीम पाकिस्तान टीम है, बस क्या है, वक्त बदल दिया, हालात बदल दिया, जज्बात बदल दिया. सो एवरीथिंग चेंज बट ग्रुप रिमेन द सेम. एग्जांपल our example, your class marks in Jan versus June exam. So what is change? June or physio versus medicine marks. So what is different? The exam is different, time is different, but group is same. If group is same, it is your peer. So peer is same group. So remember peer. So people who are couple, peer, हमेशा पास पास रहते हैं. Peer is same. Peer is same. Peer is same. So peer is same. So peer. Thank you, Dr. Strong. So peer is same. Unpeer. तो इसका peer अलग है. Unpaired is different. So peer say together. Unpaired is different. Okay. And remember, if more than two groups, then remember, if there are more people, you cannot sit in a bicycle or a bike. So no bike, no bicycle. Indians, when they are multiple groups, so when there are multiple people, what do they use? They use Innova. So how do Indians travel when there are multiple group of people? They take Innova. So here we take ANOVA. What is ANOVA? Analysis of variance between the groups. So ANOVA, Innova. So ANOVA, Innova. So I'm giving a final summary and questions. Then I'm wrapping it up. Almost we have done full file. Only the graphs are left. See, we are at page number 23. I've done the 23 also. See, China, Chinese, done. See, only what is left? The summary is done. Summary is done. Only graph is left, which is last two page. So I've covered my 29 pages. See, we have covered 29 pages. Remaining 25 pages we'll do tomorrow with other file also. So let's come back into the summary. So I'm closing this file. Okay, I'll save and close. So let me give the exam questions. Okay. So first summary. If qualitative data, what test you will apply? If qualitative data, what test you doctors will apply? Tell me. If qualitative, tell me. If qualitative, chi-square. If quantity, and there is one group, one group, it is paired t-test. Paired t-test. If there are two groups, unpaired t-test. And if there is three or more than three groups, unknown. Now, is biostats looking understandable? If there is something we can actually do, is not difficult. Only thing is, once you understand, things are much easier. Like once you understand Russian, you understand what that Devushka or that Jenshna or what do you say? समझ गया ना? Is saying. If you don't, they can say anything to you. So that is why you need to know the language. Same way, you need to know Chinese also. So language is the case. Okay. Okay, मेडिको भाई स्लो स्पीड में वीडियो देखना, पॉज कर करके सब समझ में आएगा. Okay, so now give an example. So I compare, BP of FMGs with blood pressure of IMGs. What test I should apply? What test we should apply? बताओ भाई. First two groups, BP is what? Quantity. BP is mmHg, milligram. So it is quantity. And two groups, unpaired t-test. Proud of you. Very good. Very good. Okay. Then I want to check the height of children in Delhi Mumbai, then RCB, Bangalore, okay, Kolkata, Kolkata. What test will apply? RCB, ANOVA. ANOVA. So the test applied? Test applied is our ANOVA. Ram Ram, Dr. G. Yeah, I love cricket, cricket life, more than 3 ANOVA, very good. Then I compare the cancer percentage in smoker versus non-smoker. Percentage is what? Percentage. Percentage. You cannot have a mean value of percentage. It is what? Tell me. Percentage. Quality. So that means what? Chinese mark. Chi square. Chi square. So I'll finish the class here. It is my almost 15th hour of working. I woke up 8 a.m. Then I went to class 9 a.m. Then I am taking class till 11:36 p.m. It is almost what hour? देख के फट गई मेरी. It is almost 16 hours. Almost 16 hours. So I am working 16 hours. I will now eat something, prepare the other remaining slides, surgery, etc. Prepare them, make example. Okay. Only thing I really miss is the number of students is less, because if they were more I would be feeling more happy, but anyway it's not in my control. Okay, you people or the students, they are not like kids, that you can just tie them and bring them. Okay, it's not like school attendance, students will come. Okay, in college it's voluntary. If you want to attend, you attend. If you don't want to attend, so that's why freedom is there. So that's why I believe this freedom is your part. I will play my part. Okay, I will be doing it even if there is 10 students, 20 students, because I know this 120 who are watching me live, they all are going to pass, and those who are listening to my word at even later time, you watch maybe tomorrow morning, all those who are listening, it is my blessings from all my good karma, all my good deed, all people good wishes. जो भी मुझे दुआएं लगी हैं, जो भी लोगों ने मुझे शुभ कामनाएं दी हैं, जो भी दिया है, I divert that all towards you. That anyone who's listening me, who's watching me, please, 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 you all should pass and will pass. If there is some higher power which can do this, I request with folded hand to make all my kids, all my students pass the exam without any hindrance. Okay, so that is my blessings from the core of my existence for you people. Okay, so good night, take care, bye bye. Let's meet tomorrow and we'll finish PSM tomorrow. Okay, we are on track. We are not, this is the 10th subject. I have covered 10, so have trust. If I have covered 10 subject, I will cover 19. Yes, some subject I might do very fast, rapidly, like biochemistry, anatomy, because time is less for me. Okay, chalo. Fine. So let's start. What you are saying, Anika, I'll give a advice. Okay, just keep studying. If you think I am not able to recall, it's the biggest misconception. I told you that day also. The key to your answer is there in your mind. Okay, you are not able to see because it is hidden somewhere. Same way, what you are studying is going somewhere. It is in your body. Like example, you eat this peanuts. Will it go to your body or not? Yes, it will go. Clear? You might not see it. It is there. It is digested. Now it's a part of your body. Same way, whatever you study, it is going to go to your mind and it will be there on the exam day. So please keep on studying. Okay. Yeah, sure, sure. I will take care of my health. Thank you very much. Take care. Bye bye. Yeah, love you all. Take care. Bye bye. These are the people who make me. Tomorrow PSM will be done. So tomorrow it will be. Okay, Anika, I'll tell you, don't worry too much about the PYQs. You just revise, study, and don't pay much attention to the outcome. Okay, it will just make you stress. Directly perform in the exam. My blessing with you. You will do well without any negative setback. Okay, you will score century in the direct final of the World Cup match. So you'll score 150 plus. Okay, चलो just read the MCQ, don't solve. Read answer A, okay, इसका आंसर B, ऐसे पढ़ लो, ठीक है. Don't be afraid, okay. You are all sitting with me at almost 12 o'clock. Do you think you will fail? No, nothing can make you fail because you people are giving your best. So how can you fail? People who give their best never fail in their life. They are always winners. Okay, like I am a winner. Even if I lose, let's say my coaching, I lose my maybe money, my house, my team members, I will not be a loser. Reason? I work. Okay, for me, it is like when you see an Indian team losing with a very close margin, you don't feel bad. Okay, no problem. But if they lose very badly, you feel bad. Same thing. Don't lose heart. Don't lose hope. You will do very, very, very okay. Yeah, I never delete. Good question. Why will I delete? I never delete. Clear? Don't give GTs now. If you are giving GT tomorrow, give it. If you are not prepared now, don't give GT. Just give you negative mind. If you are not prepared, skip the GT now. Only focus on revision, revision, revision. Chalo. Take care. Bye bye. Good night. We are going to wrap up. I'll eat something. Otherwise, I'll sleep without eating. I'm so sleepy. My eyes are not opening. Waking up 8 o'clock is the worst thing in my life. I hate waking up. I don't know why people wake up so early. I hate you people who wake early because I can't wake up. Chalo, bye bye.